I request Dr. Lee to begin his talk. He is a very eminent urologist from China, and we'll like to understand from his side that how the flexible ureteroscopy is being performed in his country and what is the consensus right now in China. So, Professor Lee, please carry on.
Thank you. I'm honored and pleasure to attend this excellent workshop and making friends with Indian urologists. So I would like to thank Dr. Chandra Mohan for inviting me. So today my talk is going to be about durability and cost effectiveness of flexible ureteroscopes. As we know, flexible ureteroscope technology has experienced 60 years of evolution since its first clinical use in 1960. However, the high breakage rates and expensive repair costs remain the major concern of utilizing the reusable flexible ureteroscopes. So this table listed the durability of flexible fiber optic ureteroscopes. We can see before major repair, a reusable flexible fiber optic ureteroscope could only be used no more than 50 procedures and no more than 80 hours. So can we improve flexible ureteroscope durability up to 100 procedures? This manuscript gives us some helpful suggestions. In this study, two new flexible fiber optic ureteroscopes, FlexX, were utilized for therapeutic and diagnostic indications, mainly for stone management. The sterilization method was complete immersion with CDEX. So 9.5 French semi-rigid ureteroscope was always used at the start for an urethro-optical predilation and to explore the upper urinary tract for possible lithotripsy, laser ablation, and biopsy. So then the flexible ureteroscope was introduced sequentially to explore the remaining calyces. For lower pole calculi, the stone was relocated in 65.2% and managed with non-flexed flexible instrument 90% of time. At the end, the two scopes achieved 113 and 102 procedures before repair, respectively. And this result was achieved with the low use of urethral lactate sheath and pre-stenting. Then the authors made some suggestions as to how to improve flexible ureteroscope durability, such as minimizing the work undertaken with a fully deflected instrument, introducing laser fibers and guide wires when the instrument was straight, routine use of 9.5 French semi-rigid ureteroscope at the start for urethro-optical predilation and to explore the upper urinary tract for possible lithotripsy, laser ablation, and biopsy. Choosing a low-risk sterilization method, which is a key element, because previous studies have demonstrated that some sterilization methods could cause damage to flexible ureteroscopes, such as the Steris 1 system. This study analyzed location and etiology of flexible and semi-rigid ureteroscope damage. based on the data from 4 major ureteroscope manufacturers: SMI, Olympus, Karl Storz, and Richard Wolf. The flexible ureteroscope damage often occurs to the working channel, shaft, deflection components, and eyepiece. The major causes of damage or the working channel damage from laser burn or instrument passage, and extreme scope deflection with an indwelling instrument. So the authors concluded the flexible by taking a precaution to eliminate laser fiber-induced damage, and by avoiding over-deflection, the damage occurrence and the repair costs can be minimized. Of course, the improved storage and handling of these instruments is also necessary, but the key point in maximizing the longevity of these commonly used instruments is physician and staff awareness of fragility of these delicate instruments. Are previously repaired flexible ureteroscopes as durable as newly purchased ones? This study demonstrated newly purchased flexible ureteroscopes provided 40 to 48 uses prior to initial repair, while refurbished ones averaged 11.1 uses before needing further repair. So it appears after damage occurs to a flexible ureteroscope, more damage occurs with greater frequency. So the cost of maintaining a previous used flexible ureteroscope should be carefully considered in comparison to the cost of purchasing a new one. In addition to repair costs and purchase costs, there are other costs associated with flexible ureteroscope reprocessing. In this time-driven, activity-based costing study, the authors followed 10 reusable flexible ureteroscopes through a reprocessing pathway. They quantified the reprocessing costs of resterilizing reusable flexible ureteroscopes between surgical procedures. They created process maps and assigned costs for each step in that pathway. What they found was the average reprocessing time was 229 minutes, and the total cost for that reprocessing was $36.88 US dollars. But I think what's most dramatic is how long it takes to process the scope through that pathway. And inefficient reprocessing and unavailability of flexible ureteroscopes sent out for repair can contribute to expensive operating room delays. There may be patient safety issues associated with reusable flexible ureteroscopes. This manuscript detailed an outbreak of atpanem-resistant Enterobacter urinary tract infections. In 2010, the authors found atpanem-resistant Enterobacter in urine cultures of 15 patients who had undergone flexible ureteroscopy prior to the infection. When the authors assessed the source of these recurrent infections, they found the outbreak of trypanosome-resistant Enterobacter UTI was due to the disinfection failure of a contaminated flexible ureteroscope, which had been colonized by a resistant colon, probably after being used on the case 1 patient. So taking this information together, we can see how the genesis of single-use flexible ureteroscopes. The idea of single-use flexible ureteroscope may be able to improve on high breakage rates and expensive repair cost of reusable flexible ureteroscopes, and the complexity of issues that are associated with reusable endoscope reprocessing. The first generation of single-use flexible ureteroscope technology was fiber optic and had limited deflectability. Recently, single-use flexible digital ureteroscopes have gained popularity in clinical practice. This manuscript by Ben Chu's group from Vancouver General Hospital reviewed currently available single-use flexible digital ureteroscopes, including LithoVue, Uscope, NeoFlex, and Shotgun. Generally, the functional capability of these single-use flexible digital ureteroscopes, including deflection, irrigation, and optical properties, are comparable to conventional reusable flexible ureteroscopes. The upper image shows the eventual benchtop comparison between a reusable flexible digital ureteroscope, Flex XC, and two single-use scopes, Uscope manufactured by Poussin and LithoVue manufactured by Boston Scientific. The two single-use flexible scopes have less deflection diameter than conventional reusable flexible ureteroscopes, which enhances their ability to explore the renal collecting system. The lower image shows the deflection status of these three devices in the lower pole of a single patient. Some single-use flexible ureteroscopes, such as Uscope PU3022A, integrate snake design into their active deflection part, which render the tips able to make a second bending in the direction opposite to the first bending. This design may be helpful in some difficult intraoperative settings. The single-use flexible ureteroscopes are much lighter than conventional reusable scopes. The LithoVue is 277.5 grams. The Uscope E3022A with only 250 grams. It's well known operating with heavier instruments leads to more discomfort and potentially increases the risk of committing errors for tasks that require precise hand movements over a prolonged duration. The lightweight feature of single-use flexible ureteroscopes may help reduce the user's fatigue, especially during prolonged complex procedures. Although single-use flexible ureteroscopes demonstrate certain values in comparison to conventional reusable scopes, the cost matrix is going to be important when these devices are utilized in different clinical settings. The total cost per case of single-use flexible ureteroscopes is mainly the acquisition cost of the scope. The total cost per case of reusable scopes includes the original purchasing cost per case, repair cost per case, reprocessing cost per case, and the labor cost per case. This is a micro-costing analysis comparing reusable flexible fiber optic ureteroscope URF-P6 and the single-use list view platform. The authors collected the workflow data, including the intraoperative events, post-operative reprocessing cycle timing, consumables used, and the ureteroscope cost data. From the figure drawn from this study, you can see the total cost per case for utilizing URF-P6 and utilizing this view was similar. 2,799 US dollars for URF-P6 on the left, and 2,852 US dollars for this view on the right. If we look at the figures of themselves, we can see the greatest cost component for URF-P6 was the operating room time, followed by the repair cost. For this view, the greatest cost component was the acquisition of the scope, followed by the operating room time. So the authors and the cost of reprocessing and disposal was fairly low in both settings. The authors concluded that the acquisition cost per case for single-use list view was higher than that of reusable URF-P6. But savings were realized in labor, consumables, and repair. When accounting for these factors, the total cost per case utilizing URF-P6 and list view were comparable. While individual institutions vary with regard to case volume and cost control strategies, this study demonstrated that single-use flexible ureteroscope is cost-effective alternative to conventional reusable flexible fiber optic ureteroscopes. Another study is a cost-benefit analysis looking at the economic implications of a reusable flexible digital ureteroscope. If we look at the materials and the methods, we can see ureteroscopic procedures were prospectively recorded over the 12-month period. All flexible ureteroscopies were performed using digital ureteroscopes, Flex XC. cost assessment was based on the original purchasing cost and the repair exchange fees divided by the number of costs. The authors created an algorithm to include per case reprocessing costs and calculate the benefit to cost ratio. This cost was compared to the potential costs of the list view single-use digital ureteroscope. And the cost of the single-use list view was based on the marketplace at the time of this study. Certainly, the prices will change based on the ever-changing market. This figure presented in this study shows the total cost benefit in the vertical axis over the number of cases in the horizontal axis. Based on the cost of the author's institution, the break-even point comparing reusable flex XC and single-use list view was achieved at 99 flexible ureteroscopy cases. After which the cost-benefit comparison favored reusable scopes over single-use scopes. So it appears single-use flexible ureteroscope may be cost beneficial in centers with low case volume, but institutions with high volume of cases may find reusable scopes cost beneficial. The threshold of cases per year of an institution preferring reusable flexible ureteroscopes instead of single-use scopes may vary. And this cost-benefit comparison will not directly be reflective of the viability of single-use flexible ureteroscopes in other institutions, but the concepts of the algorithm can be used to determine whether reusable or single-use flexible ureteroscope is financially advantageous, with cost variables being adjusted to the current marketplace rates. This prospective cohort study analyzed the clinical outcomes and costs of reusable and single-use flexible ureteroscopes. 68 flexible ureteroscopies utilizing reusable Flex X2S and Flex XC. Another 68 flexible ureteroscopies utilizing single-use list view. The cost analysis was based on the purchase costs and recurrent costs for reprocessing and repair, divided by the number of procedures. This figure, drawn from the study, shows the total investments in the vertical axis over the number of procedures in the horizontal axis. The linear graphs demonstrate the lower and upper limit of the range of costs for single-use and reusable flexible ureteroscopes. For reusable flexible ureteroscopes, the linear graphs start at the level of total purchase costs. If the single-use flexible ureteroscope was at the lower limit price, the total cost would exceed the lower limit of cost for reusable flexible ureteroscopes after 61 procedures, and the upper limit of costs for reusable scopes after 118 procedures. The authors pointed out partially overlapping ranges for reusable and single-use flexible ureteroscopes stress the importance to precisely know the expenses and caseload before negotiating purchase prices, repair prices, and warranty conditions. In this retrospective cost analysis of a single-center reusable flexible ureteroscopes program, ureteroscopy program, the authors assessed the economic aspects of reusable flexible ureteroscopes compared to the costs and benefits of single-use risk view platform. Then the authors proposed the indication for utilizing single-use flexible ureteroscopes, such as based on the risk factors of scope damage, such as multiple large stones in the lower kidney pole and a steep infundibulopelvic angle. If urologists recognize that a certain case will likely result scope damage, then perhaps it was cost effective to use a single-use flexible ureteroscope. So in summary, the longevity of reusable ureteroscopes can be maximized by paying scrupulous attention to details intraoperatively and extraoperatively. Single-use flexible digital ureteroscope is a trend, but cost matrix is going to be important. It's going to be important based on case volume and cost control strategies for different institutions. Irrespective of case volume of different institutions, there is a niche application of single-use flexible ureteroscope in thoughtfully selected cases at high risk of scope damage. This is my hospital located in Yantai City, Shandong Province, in the middle of China by the sea. So it's a beautiful coastal city. So welcome to Yantai. Thank you very much.
Thank you, Professor Lee, for your nice comprehensive view about disposable flexible ureteroscope. If I have to summarize your talk, I will say a few sentences about it. That when one makes purchase of a scope, he will look at several aspects. One is the cost. The first is the caliber of the scope, whether it is allowing your access to pelvic alysis system or not. So digital ureteroscope and the disposable ureteroscope, because we are comparing both the digital scopes, disposable and non-disposable digital scope. So the caliber is almost the same. So it is matching into it, but still we can reduce on the size of the disposable scope so that the entry into the pelvic alysis system becomes easy. Then probably it will be more acceptable. Second is the deflection. It is matching a 275 degree on either side, so that's very, very good. Durability, we are not worried because it's a single-use disposable scope. Sterilization, you are not worried because you don't have to sterilize the scope. And the last is the cost, where buying a flexible scope is comparatively cheaper. Buying a regular digital scope is very expensive, while buying a disposable ureteroscope, for one piece it is cheaper, but it is only for one case. In India, the financial dynamics are very, very different because everybody is making a purchase from his pocket. It's not like a Western world. That's why there is a little bit of resistance from the Indian area or maybe the Southeast Asia where people are making their own purchase. That's why the acceptability of the even flexible ureteroscopy also took time in the urology population. We started from PCNL to mini PCNL, now we are going to flexible ureteroscopy. In the Western world, it started with the flexible ureteroscope, digital ureteroscope, and now the digital ureteroscope, the disposable ureteroscope. So gradually people will accept this disposable ureteroscope the moment the cost will little come down, the caliber will slightly decrease, and certainly maybe after 2-3 years when you will go to give talks anywhere in India or some other part of the world, people will be talking about disposable scope only, because the time has come. And if you review the literature, whatever is available in the journals, now there are many papers coming up regarding the disposable scope. Now people talk in the Western world, because of the sterilization problem, because of the infection problem, disposable scopes are gaining momentum. But I think excellent talk from your side. I will take only one question from the audience, and I think we will then go to the operation theatre, because operation theatre is ready. Yes, sir.
Can I ask one thing? I mean, because we are using the digital reusable scopes, and we are somehow sterilizing it, but probably not sufficiently. How can we use the reusable scopes? Can we de-sterilize it? I mean, in the way we do the normal digital scopes? Because you said that life permits about 4 hours, so that if somebody can complete the operation within 2 hours or 1 hour, so 3 hours left. So what to do with this 3 hours? Can we use it? Because the way we sterilize the other scope, like digital scopes, flexible, fiber optic scopes. So why not this one?
I think I will answer his my question. The question, Dr. Lee, the question was, you said that the one scope will last for 4 hours. But we have to remember that we are a scientific forum where we have to discuss the utility of the scope, and it is a single-use scope. So whether you finish the procedure in 30 minutes or 20 minutes, you have to use it only for once. And the very purpose of introducing this disposable scope is that you don't want any infection also. So you cannot use it in some other patient. So you have to be careful about it. But if you, in your private practice, in India, people do they use it? Yes, they use it. But he is giving a scientific talk, so I think probably it will be not possible for him to answer to this question publicly. Maybe you can ask him privately. I think thank you very much, Professor Lee, and I think we move to the next session.
Thank you.